The final observation checklist in placement logbook 3 is related to cluster 7, administering medications. And as you can see on the summary table, the remaining performance evidence will be assessed in simulation. And then this first one in the white will be what we're going to cover in this observation checklist. So as you can see here, students are required to administer medication with 100% accuracy for at least 3 people in the workplace, and both through oral and subcutaneous administration. So in this first section, it's oral medication administration. So we want you to administer it on 2 people, and we want it to do it in accordance with the 8 rights with 100% accuracy. The first attempt, obviously it's the same thing, circle if it's satisfactory, and the facilitator will initial to verify that. If you have not satisfactory for any of these, you'll be required to repeat it, and you do need to gain a satisfactory score at the end of it. So they're the 2 examples, and obviously it's following the normal process that you would do when you're administering medication for oral medication. The second checklist is related to subcutaneous administration of medication. This is incorrect. This should say subcutaneous. But this is your 3rd and your 4th observation. So as you can see here, it's very similar checklist to the above one, but obviously because it's a subcutaneous injection, there's different steps within the checklist to ensure that you're delivering the subcutaneous injection appropriately and in accordance with the appropriate essential skills checklist. So same thing again, attempt 1 and attempt 2. So we want to be sure that you gain satisfactory attempt for all of these to be deemed satisfactory for this competency. There's the 2 checklists there as section A, part A and part B. The supervisor will provide feedback on how you went, and obviously again, response from yourself. Now for the medications reflection, because obviously before you administer any medications, it's imperative that you understand why you're giving that medication. So the indication for the medication, any contraindications, that it's a safe dosage, and any potential side effects that may occur. Now we want you to choose 4 medications that are administered through 4 different routes. So an oral medication, a subcut, intramuscular, and a peripheral IV injection. So 4 medications from 4 different routes. You're encouraged to use the medications in your patient's drug charts, because obviously you'll be researching those and ensuring that you understand these indications, contraindications, appropriate dosing, that kind of thing anyway. If you do not happen to have a patient with a peripheral IV injection, you can choose the IV medication yourself, but we would prefer that you refer to the patient drug chart of those that you're looking after. For each of the 4 medication routes, the medication you're required to do this reflection. So basically the drug name, dose, the frequency and administration that's required, as well as a calculation of the dose from the stock strength if it's appropriate. So if you have a medication that you have to do a drug calculation, then this is what we want you to record in here. If not, then that's obviously not applicable. Whether it was a scheduled drug and why it's been prescribed, so the indication for why you're administering it, and any possible side effects that medication may have. So it's basically the same reflection for all 4. So the subcutaneous, again, the drug name, dose, frequency, and administration, any calculation that you had to undertake when you were administering this medication, as well as is it a schedule, why has it been prescribed, and possible side effects. So same again for intramuscular, and same again for peripheral IV injection. So that brings us to conclusion of the performance evidence checklist.